I'm Cait.
And this is Crib Notes.
And we're your nurse practitioners specializing in pediatric healthcare, here to talk to you today about vitamin D.
What is vitamin D? Vitamin D is a substance that the body needs to absorb calcium and phosphorus into the bone. It helps our bodies grow nice and strong.
So why do we worry about vitamin D deficiency? In children, vitamin D deficiency can lead to issues with bone development. This condition is called rickets. As a result of vitamin D deficiency, the bones don't form correctly, they become weak, they can bend, and they can break easily, and children might complain of pain.
Vitamin D deficiency has also been linked to increased risk for high blood pressure, diabetes, heart disease, and having good vitamin D levels can also support immunity and your overall mood and energy levels. Cait, how much vitamin D do we need?
So the American Academy of Pediatrics recommends that all infants receive a minimum of 400 international units of vitamin D a day, and this is beginning soon after birth. For children, the recommendation increases to about 600 international units, and that's the same for adults. Although many sources even say adults should get somewhere between 1,500 and 2,000 international units a day. Kaylee, how do we get vitamin D?
So a lot of people can get vitamin D through natural food sources. This includes fatty fishes like salmon, sardines. You can also get it through fortified food sources like fortified milk, cereal, orange juice. And the tough thing is that these sources only usually have 40 to 100 international units of vitamin D per serving, so it can be hard to get that 400, 600 plus amount of vitamin D into your diet through these food sources. There's also the recommendation that you can get your vitamin D levels up by doing 13 to 15 minutes of outdoor sun exposure about 3 times a week, but this also is the amount of sun exposure that could increase your risk of skin cancer. So since it can be a little bit tricky to get your vitamin D through food sources and you worry about sun safety, what are some other ways that we can get the proper amounts of vitamin D into our kids?
Yeah, often we recommend that patients will supplement with vitamin D, meaning they'll take vitamin D in a drop or a liquid or a tablet or a gummy form. For multivitamins, many multivitamins also contain vitamin D, so they'll generally have the recommended amount. Vitamin D comes in 2 forms, D2 and D3. D3 is animal-derived and is generally a bit more effective, where D2 is a plant-based formulation.
Some things that can increase your risk for vitamin D deficiency are having a darker skin tone because you don't absorb as much vitamin D, living further from the equator, like us in the Northeast where pretty much everybody is vitamin D deficient, or wearing sunscreen, which is always a good thing. We don't want to discourage that. Or even living in highly populated areas. You know, cities have a little bit more smog, denser cloud covering in some areas, and you may not be going outside as much as your more rural friends.
So what should you do if you think that your child's not getting enough vitamin D? Talk to your provider, review your child's diet, think about what they're eating over the course of a day. And if you're worried, we can test for vitamin D deficiency through a simple lab draw.
Right. Most kids are fine with just the over-the-counter supplementation of vitamin D, but some kids who have really low vitamin D levels do require prescription supplementation. Thanks for watching this episode of Crib Notes.
Don't forget to like and subscribe.
Bye.
Bye.
Always remember, your child's health and wellness is nuanced by their unique physical makeup, as well as your family's particular social, economic, and environmental situation. Please always consult your own pediatric providers when making decisions about your child's care.